vertebrae
I
to
thought you
the
already
right.
got paper thrown at
So
you.
rotate
That's
to
why
the
you
right.
have a machete.
And scoliosis even, yeah, and there's a flare of ribs on the right.
Okay.
What kind of stretch, what kind of techniques you're showing me, so.
I thought you had
Well, I'm just hypothetical, just.
but why don't you hernia?
Yeah, that's another problem.
Okay.
Okay. So usually when the ribs come up, when you just stand on his back and the ribs comes out like more on the side and lower on the side when we touch, if he turns on supine position, we're gonna see the difference. This side here
This one
is gonna be higher and this one is gonna be lower. But it's not only one or two vertebrae, right? It goes like a chain, slowly, like little segments of movements from lower going up, up, up. It goes like the DNA, you know, the DNA has this kind of movement like that.
Twists
Same thing,
like that.
twists like the DNA like that. Doesn't twist like, for example, like any other thing. They say, oh, the one vertebrae is just little moves. So it affects the whole chain of the vertebrae. So on the front side, when we do the assessment, for example, we see that this side is higher on the chest
And this
here,
one's caved in
or
here.
the ribs here. You see the side of this higher, and you see them lower. And when he goes on his back side,
I actually do have that though.
okay, all right, yeah, okay, yeah,
I think so.
see. So it's higher, and then when you turn on your back,
On my side?
on your back again. So we're gonna
Oh, on
do
my
it
stomach?
with it on the stomach, yeah. Yeah, on your stomach. Sorry. So here on this side is gonna be higher, and this side is gonna look lower. So when you put the hands here, for example, you can see your hands high because he has clothes right now. Like it's not naked. It's like so. If he has clothes, I put my hands here. I make sure there's nothing underneath the clothes to create the.
You haven't had enough?
Not quite.
We can't get enough of each other.
And so this is flat like the other side, right? So this one is higher and this one is lower. And in this case, I'm just gonna go all over the vertebrae here to see. But because there's so many muscles and fibers there, is some people can have a lot of layers of fat to results. I'm not gonna be able to find to everybody. So this is the only way to find them very easily. Just by putting the hands this hand. Because we're gonna choose transverse process and all of this one is gonna be the hardest way to define to everybody. So in this case, I turn the person on the side, or the client, or the patient, or whatever you like. And one is on the side here. First I prepare, not right away. First I start preparing.
Some twisting, hey?
Just a little bit of it to see how is the movement here. So second by second, for example. There. I check if there's any pain when I compress in the side. Like that. You don't have any pain on this one either, right?
No. No.
Good. And alright. So when you can stay straight, turn around this way. Good. So come here. Come closer. Bring yourself closer.
Legs off?
Legs off there. Yeah.
Well, that's a good stretch. I can
And
really
a
feel that.
stretch, yeah. Since these are more
Short, hey?
short and on the side here, you do the opposite. You do the opposite rotation and opposite where is this like contracted here. We do the opening on the side here and the rotation on the other side. Because of the weight of his legs, I put the legs out so naturally.
The QL's already
So,
stretching.
yeah. But when these legs go drop down, also the pelvis is gonna follow the legs
Mm-hmm.
on the side here. So it's gonna give a QL stretch. It's gonna give all the multi-fibers muscle stretch. It's gonna be able to
On the right side.
On the right side. It's
And you pulled in the shoulder too, didn't you?
if you, yeah, when you pull the shoulder, he's like, for example, stabilizing, not letting all the whole body following.
Like this,
yeah,
basically,
like that.
if you're
So
really
that's why
tight. Yeah.
If I press here just to keep your positioning, so
Yeah.
it just stays there, and you just take the breath, like deep breaths. The more that you take, you say yeah.
Yeah, I
Because
can
it
feel
helps
that's.
it helps also with the rib because at the same time also the ribs, and the intercostalis muscle also get stuck on the side too. So this is why when you do this also with the
Opens the
inhale and
joints too,
exhaling,
probably.
it opens also this side as well.
Do you do any myofascial techniques on the right side?
I let it rest first, and I
Yeah.
ask you if you have any pain or is anything bothering or something. Or I ask you.
So
where
you
do do
stretch
the-
before?
It doesn't work for everybody. Different bodies, they have different kind of weights in different or like restrictions in any joint. For example, this stretch work for him. That's what I'm doing because it's, I feel it. It's because I asked him before. I said, "Do you feel the stretch where I want this to be feel?" He said, "Yes, I feel it here." He said, "I feel it in the QL." I said, "Okay, this technique is work for him." But if he says like when we did yoga together, you remember you asked me like, "Where do you feel the stretch?" Because if and you change the position of mine,
Yeah.
you feel the same thing like different heights, different levels of their body, right? So same thing with this. Like, since he felt where he's supposed to be feeling it, I said, "Well, okay, this technique works for him." But somebody else said, "No, you tell me this way, but it's not working." Some people are by the book. No, somebody says, "I'm gonna do like this," but it's not working for the person. So
Is this all you do, or you?
yeah, I tell if I do it to somebody else that doesn't feel it, then it's not the right technique for this person.
What other technique would you do for this, or this is your main
But
one?
it should be a different person. It should be a
Yeah,
different thing
yeah.
to be more realistic with the example, right? In your case, I did this because it's more realistic for you and
Yeah.
more effective for you.
That's right.
Because
It's
always said, the best
individual
technique is the one
based.
that works. Somebody's more know. If I do this to an old person, he would be walking in, or he'd be like for a week like. Not just be like
Bent.
muscle ruptures and maybe mini fractures as well. There you cannot do, but he's young, his muscle are more flexible, more elasticity, so I can do this to this person. Different ages, different weights, different depends. This way we do
Mhm.
the stuff. So there you relax, and then you come back to the position there, and then you turn on the side again, right there, and there. I let the body to come in the circulation of the blood to go back to slow, because if I keep for too long in the position, it's gonna start numbness and all this kind of stuff. And
Yeah, you don't wanna hold it too long in the stretch.
You're getting
yeah.
uncomfortable for
Mhm,
sure.
mhm.
Too much is always too bad. So
Mhm.
then I check it out. I see the texture of the muscle if I'm sticking it.
And everything's moving better after the stretch usually. Yeah.
I check again the movements here, how they are they restricted like they used to be before, small ones. I'm going to the ribs to see how the shoulders as well are doing there, because it affects. I do the.
I guess the scapula could probably get stuck on that right side if the ribs are flared up.
Everything related, everything matters. Like it goes like all like slowly. It depends on the time.
Yeah. What's that?
Nothing. Only words about it.
Also, it depends when you do this one. Depends where you keep your hands, because in this case, he has very short distance between his last rib
And the
and his
crest.
iliac crest here.
Yeah.
So I go to the last rib and iliac crest there.
And open it.
I ask if he's in any pain, if he's in any trouble, do the breathing and stuff like that. So.
Awesome. Awesome.
Do you feel stretch?
Yeah.
Not like the one we did with
No,
the
no,
legs
no.
down
Well,
there, but
it-
yeah, it's
like,
like very,
yeah.
very gentle stretch.
Yeah.
This one I usually would perform only with underwears. This is the guy like maybe you can have like a scarf on top of it, because much clothes more restrictions, because not every clothes are elastic, right? Like this one are not very elastic. But it's Canada,
Shorts
I
and
know
a
you're
tank
right.
top. Yeah.
We're not in Jamaica, which you can do, you know what I mean? But
You do
back
want
on
some funny.
in my country, that's what we do. Like in the
Yeah,
beach.
Europe loves
Yeah.
nakedness.
Yeah.
You guys love naked beach, naked everything. Over there,
Not in Russia. Russia, they can have some type of.
No, Russia's
Extra
they're
weight.
quite timid there.
Yeah, Russia
Yeah,
like
Russia's like
concerned.
4 or 5 layers of clothing. You
Oh.
ever see that joke on Family
Well,
Guy?
if you're in Siberia, yes, of course.
You see that joke on Family Guy? It's like it's so dangerous to like have hookups there, because it's like they have these big coats. It's like, okay, on the count of 3, drop your coats. 3, 2, 1, drop the coats, and then you see what's
And
underneath.
then neither, like if you know the massage techniques, and since most of the people are, for example, you are registered massage therapist somewhere, so turn the person on his back, go on your back, sorry, on your stomach, prone, and then start in the
And then you're-
relaxing all this muscle. So you go
Now
from
you're
the hardest
rotating
one,
them
you
back
start
like
to go
this.
slowly.
Oh, okay, so you didn't really do too much myofascial, just like a stretch and then. Okay.
Go all over there, try to push, and also take a deep breath.
If you guys only knew what was going on in my head right now.
I know what's going on in your head right now.
She's in Jamaica.
No, I'm in book talk. Book talk is fantastic. Definitely the one.
And then I'll hit the balls, for example, we can turn on the side again, on the balls, so I go higher in area on the rib side.
Yeah, to open this.
So start
Okay.
opening this up. And your hand here.
Yeah, position.
Position the head like that.
What's that?
Nothing. I promise only Larissa is getting.
And deep breath. And relax. Deep breath. And relax. It's more passive right down the gravity there, so you don't need to use so much of your body. Or active, it's not like.
When were we whispering?
Who's whispering? I've been saying it loud and clear. It's
No,
just-
no, when
Yeah.
we were whispering, you said.
Oh, when they were doing the last,
When we're at the spine, at the corner.
no, I don't know what you guys were doing, but like she was trying to teach something, and you guys were not even whispering quiet. Y'all was loud as hell, and I'm sitting here like, okay, Ty, zone them out, trying to focus on this. I hear you gonna go like this. You're gonna go, but why are you doing this?
Oh,
And
that's why you threw the.
Like, yeah, and I was like,
The paper at you?
I was like, yo, look up there and just hold your head straight. Why? Because it's me. It's because if me get ignorant and dark in here, I don't know why I'm gonna be my friends. I'm saying something. But if I just hold a piece on my chest, you see, I'm just gonna hold this, I'm just gonna hold my chest. I'm gonna close my eye. Because I'm just saying my head at your bones. My head at your bones. But this is it's
Is this Philly? Okay, good.
It's a tight hold your
You
piece.
feel that?
No.
But General
No.
said.
She's just her.
Shadows that did already fit tump out to the clot. You see, I say yeah. But I said, what out your peas? I said, they might try to continue over there.
Okay.
But then, you know who really come with it? Me know what you say. You know what you're doing? I said, I said,
Thank you.
No, nothing. I don't want to come to.